is your temporal mandibular joint, your mastoid process. It's right here. Your styloid process, which is in here. Your external acoustic meatus, which is here. Your squamous part, which is on the inside, so it's right here. You've got your lateral and orbital parts, greater wing. Right in here. Your superior orbital fissure, which is up here, which has a lacrimal nerve, the frontal nerve, abductions nerve, inferior and superior division of the oculomotor nerve, trochlear nerve, and nasociliary nerve. Your temporal internal views, your temporal. You have the Petros part, which I'm going to show you in this book. So you got your Petros part, which is inside, right here, is right there, that ridge, which is part of the temporal bone and has squamous part, zygomatic process, mandibular fossa, tympanic part, external auditory, styloid process, mastoid part, and mastoid process. Internal acoustic meatus is right here. Then you've got your lesser wing and greater wing of your sphenoid bone. I'm also going to show you in the book the internal view. So your sphenoid bone, you've got your lesser and greater wing right here. Your optic canal, which is right here. Your sella turcica is right here. It's right in this area, which has pituitary gland that sits in the fossa, and the optic canal has the optic nerve, the ophthalmic artery, central renal vein, and sympathetic nerve. And now it's the ethmoid bone, the internal view. So again, I'm going to use this. You got your crista galli, which is right here. All these little dots right here. It protects, the function it protects superiorly between the cribriform plate, which is triangular process called the crista galli, rooster's comb, the outermost covering of the brain. The dura mater attached to the crista galli and helps secure the brain in the cranial cavity. And then you got your cribriform plate, which is just right below that. And that has sensory neurons, the synapse, with the olfactory bulb of cranial nerve 1, which lies on top of the cribriform plate. It's right here. And then we're going to move to the vertebral column, which I'm going to point to you on here. It's the vertebral column. You got your atlas C1, your 7 cervical vertebrae. So you got your 1, 2, 3, 4, 5, 6, 7. And then the atlas, which I talked about, is the occipital condyles. Thoracic vertebrae, there's 12. Spinous process, it's right here. The little point. Transverse process, it's like the side. Transverse. Intervertebral foramen, which has a spinal nerve, dural root sleeve, lymphatic channel, spinal branch. And then your body of centrum, which I'll show you on here on this book so we get an idea. Let's see. Okay, so you got your C1 and C2 for the cervical vertebrae. And then you got your thoracic, body centrum. Let's see, you got your transverse processes. This gives you more of a, so you can see this is T1, T7, and T12. Transverse process is right here. This is your spinal process. And then let's see, you also got your lumbar vertebrae, which are, there's 5 of those. There's sacrum and your cox. And your sternum. Your sternum right here. Okay. You got your manubrium. Let me show you. The manubrium is right here. It's not very well defined. Let me show you. The manubrium kind of gives that like divided up here. This is the body, so this is the body right here. And then you got your xiphoid process right here. And your jugular notch is right up here. You got your ribs, your true ribs, false ribs, floating ribs. So your true ribs, let me show you. You got your true ribs, which are usually from here down to here. Your false ribs, which are hanging. So it's these ribs right here, which, you know, and then you got the floating ribs, which are right here. These are the floating ribs because they're not attached. So that would be 11 and 12. And then let's see, head and neck. A tubercle rib. Most ribs have facets by which they articulate with the thoracic vertebrae. So they normally articulate. It's hard to show here. But yeah.